this to me is kind of the knockdown piece of evidence that this is not an effective treatment for COVID-19, right?
Mm.
And this is fairly basic kind of chemistry stuff. Um, when you're talking about a drug, when you're talking about like kind of giving any kind of drug to someone, you're talking about kind of a dose response. So you dose, like you take ibuprofen, you take 800 milligrams of ibuprofen. You get a spike in your blood plasma. The level of the drug spikes. It has whatever effect it's going to have, and then it kind of decreases in concentration as it is converted to something else in your body. This is basic pharmacokinetics, toxicokinetics work. And so the reason that anybody thought this drug was going to be useful against COVID-19 is that they were testing a whole bunch of stuff, and they found that a range of 5 micromolar concentration of ivermectin killed SARS-CoV-2 in a vitro, in a petri dish, effectively.
Oh, this is good, because this is one of the things I wanted to ask you. Why did anybody ever think this? So
no, I mean, look, the thing is that
because not these things get started, and it's not usually just something sort of picked at random. There's usually a reason why something gets lit upon.
Right. It wasn't like picked out of a hat, essentially.
Yeah.
There are hundreds of drugs currently being tested, and particularly if we can find something that is cheap, that is easy to manufacture, that is off patent hypothetically, so that we can spread it around the world and give it to billions of people to cure the disease or treat the disease or act as a prophylaxis for the disease, then this is the gold standard. Everybody wants this to be true.
Yeah.
There is no one working in the world today who actively wants ivermectin to not be an effective treatment for SARS-CoV-2.
I know I keep interrupting you, right. But this is another thing. Bret does this thing in one of the episodes where he's going, well, it's there and it's cheap and it's safe and it works and it's widely available. You can buy it from the shelf. And it's just so evil that they're telling people not to use it. It's the crime of the century that they're suppressing that this easy, safe, available cure is. And I'm listening to it and I'm thinking, why are they doing this, Bret? I mean, firstly, who are they?
Well,
and secondly,
it's the pharmaceutical companies. The pharmaceutical companies want to make money off of their vaccines, their new fancy vaccines that they can actually make money off of, and nobody makes money off of ivermectin. And so it is because there is this kind of confluence, this collusion between academics and pharmaceutical companies and the media, and everybody is just like that. You can't have a cheap drug that's actually effective. And we are the ones telling the truth about this, as opposed to who are you going to believe, me or those lying pharmaceutical executives? And you know what? Actually, the pharma industry is ask anybody who works in the pharma industry. The pharma industry is crap. That does not mean that the data that is being produced in terms of the efficacy of these drugs and these vaccines is fraudulent, unless you can find out why it's fraudulent, right?
Yeah.
Do you think the restaurant industry, the fast food industry, wouldn't have loved to find out that you could give somebody a 2-week dose of ivermectin, and suddenly you can pack all your low-wage employees into the kitchen again,
and all the customers can come back,
and all the customers can come back, and all the Guatemalans who are picking fruit in the farmlands of Kansas, if you could just give them all ivermectin when they got sick, and suddenly you could produce more. Before we get into that, I mean nice aside there, but I did just want to highlight this here. This to me is sort of the knockdown evidence that you've got to get any conversation about whether COVID is cured or effects ameliorated by ivermectin kind of has to pass this hurdle.
Yes.
And this is, I'm quoting here from this piece by Scott Gavura at Science-Based Medicine, and he links to a paper. While it acknowledged the antiviral properties of high concentrations of the drug ivermectin in laboratory experiments, it noted that it would likely not be possible to achieve the same concentrations of the drug in the plasma of the blood because the drug itself is tightly bound to blood proteins. Here's the highlight. Even giving 8.5 times the FDA approved dose, which is 1,700 micrograms per kilogram, resulted in blood concentrations far below the dose identified that offered antiviral effects. And I have included this graph in the show notes. If you give 8 times the FDA recommended dose of ivermectin to a human being, the concentration in blood plasma is 1/200th of the concentration that was shown to kill SARS-CoV-2 in the Petri dish. Let me repeat that. 1/200th. It's at 0.01 micromolar, and it needs to get up to 5 micromolar. This is not effective. Not because ivermectin doesn't hypothetically kill SARS-CoV-2, but in order to give enough of a dose that it's actually going to get to those concentrations, you're also going to kill the host. You're going to kill the person, because ivermectin works by interfering with signals that allow the cells to work. I forget exactly which binding protein it is, but like they actually interfere with cell growth and cell activity. Like that's what it does. You would kill the person before you kill SARS-CoV-2. It's just like, this is just fundamental, basic blood chemistry stuff. And so if there were a whole bunch of studies that showed, well, we don't know how it works, we know that it works, that would be like sufficient evidence to kind of get over this, because then we get to study like what the mechanism is, et cetera, et cetera. But we don't have that. We don't have anything close to that. Yeah. And any conversation about this drug has to start from here. How are you going to get it to enough concentration in order to actually be an effective dose, if you're basing your idea on this original in vitro study? Period.
There it is. Yeah.